Hey there! I'm so excited to take you on this incredible journey from conception to 12 weeks of pregnancy. I've seen countless women go through this amazing transformation, and let me tell you, it's nothing short of miraculous. We're going to dive into all the nitty-gritty details of early pregnancy, from the moment of conception to the end of your first trimester. So, grab a comfy seat, maybe a snack if you're not feeling queasy, and let's get started. Okay, so let's start at the very beginning. Conception happens when a sperm cell meets an egg in the fallopian tube. It's like, a tiny cellular dance party where only two very special cells are invited. Once they meet, they combine their genetic material, and voila, you've got a zygote. Now this little zygote starts dividing like crazy as it travels down the fallopian tube towards the uterus. About a week after conception, this cluster of cells, now called a blastocyst, reaches the uterus. And here's where it gets really cool. It starts to burrow into the uterine lining. This process is called implantation, and it's when pregnancy officially begins. You might even experience some light spotting during this time, which is totally normal. It's just your little embryo getting cozy in its new home. Now that our little embryo is snug in the uterus, things start happening fast. By week 5, it's about the size of a sesame seed, but don't let that fool you. There's a lot going on in there. The neural tube, which will become the brain and spinal cord, starts to form. The heart begins to develop and will start beating around week 6. It's like, building a tiny human from scratch. As we move into week 6, facial features start to take shape. You've got little buds that will become arms and legs. The umbilical cord, your baby's lifeline, is forming too. It's pretty wild to think that all of this is happening when the embryo is still smaller than a blueberry. Alright, let's talk about what's going on with you during these early weeks. One of the first signs of pregnancy is often a missed period. But even before that, you might notice some changes. Your breasts might feel tender or swollen. You might feel more tired than usual. And then there's the famous, or should I say infamous, morning sickness. Despite its name, it can strike at any time of day. Some women feel just a little queasy, while others, get to know their toilets pretty well. Another common symptom is frequent urination. Your body is increasing blood flow to your pelvic area, which puts pressure on your bladder. You might also experience mood swings, thanks to the hormone party happening in your body. Taking care of yourself is super important during pregnancy, especially in these early weeks when your baby's major organs are forming. Folic acid is a big deal. It helps prevent neural tube defects. You should be taking a prenatal vitamin with at least 400 micrograms of folic acid daily. Now, about those pregnancy cravings and aversions. If you're craving ice cream at 2 a.m., it's okay to indulge occasionally. But try to keep a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated, and limit your caffeine intake to about 200 milligrams per day. That's roughly 1 12-ounce cup of coffee. And of course, alcohol and smoking are big no-nos. Taking care of your body through gentle exercise like prenatal yoga can be beneficial for both you and your baby. Okay, now we need to talk about some of the potential complications in early pregnancy. It's not fun to think about, but it's important to be informed. The most common issue is miscarriage, which happens in about 10 to 20% of known pregnancies, usually in the first trimester. Signs can include heavy bleeding, severe cramps, and passage of tissue. If you experience these symptoms, contact your healthcare provider right away. Another potential complication is ectopic pregnancy, where the embryo implants outside the uterus, usually in a fallopian tube. This can be dangerous if not caught early. If you have symptoms like severe pelvic pain or dizziness, seek medical attention immediately. Regular prenatal care is crucial for a healthy pregnancy. Your first appointment will usually be around 8 weeks. This visit is pretty exciting. You might get to see your baby on an ultrasound for the first time. Your doctor will confirm your due date, check your overall health, and run some routine tests. They'll also answer any questions you have. And trust me, you'll probably have a lot. And there you have it, your journey through the first trimester. Every pregnancy is unique, and what you're experiencing is your own special adventure. It's okay to feel a mix of emotions: excitement, anxiety, joy, and maybe even a little bit of, what have I gotten myself into? Just know that you're not alone in this. Take care of yourself, listen to your body, and don't hesitate to reach out to your healthcare provider with any concerns. You've got this, mama. Here's to a happy and healthy pregnancy. Please like and subscribe to our channel.